It is a laser. As you know, laser stands for light amplification by stimulated emission of radiation. So here you need a basic element to stimulate to get laser energy. So the basic element here used is holmium, which is an element by itself. This is mixed with something called YAG, which is yttrium aluminium garnite. And so holmium YAG is stimulated to get the desired laser energy that we use, which is very precise and has a large wavelength and a small degree of penetration. So it allows precision, and it is a pulsed laser, so it has a mechanical effect as well. Yes, it is used to treat benign hyperplasia of prostate. As you know, men, when they age over 50, 1 in 3 men above 50, and possibly 1 in 2 men above 80 will have benign enlargement of the prostate. So part of the prostate will grow due to hormonal effects of growth factors and other internal factors of the body. This is a natural process in the body. It's not a disease. So the prostate, a part of the inner part of the prostate gland grows, forming what we call an adenoma. And it compresses the surrounding part of the prostate, which thins out, and we call it the capsule. It is a pseudocapsule, it's not a real capsule. So this is what we come to is an adenoma, enlarged part of the prostate, causing constriction on the neck of the bladder and the outflow of the bladder, giving rise to bladder outflow obstruction, which can lead to urinary symptoms, which can lead to the bladder performing against a resistance, and therefore the bladder gets thickened in its coat and quicker in its action. And so we have symptoms of increased frequency, urgency, getting up too many times at night, and ending in a slow flow and difficult to pass urine, a sense of incomplete emptying of the bladder. And if this progresses, it can lead to retention of urine, which a person cannot pass urine anymore and will need a catheter. So this is all caused by a natural process in the body, which is a progressive condition called benign enlargement of the prostate. And it is a natural process related to aging. So when we get this situation, we have an overgrown part of the prostate gland, an adenoma compressing the outflow, surrounded by a capsule. So there's a natural plane between the adenoma and the capsule. And if you can enucleate the prostate in its natural plane, not the prostate, the adenoma in its natural plane, then you have the best outcome, because it is anatomical enucleation in its natural plane, as one would wish to do, because it follows, it undoes the process that naturally happens with age to achieve a freedom from obstruction of the bladder outflow. Now, this is done very effectively with the holmium laser because of its precision, of its less depth of penetration, and mainly its pulsed nature, where it has a mechanical effect that teases the adenoma of the capsule in its natural plane and aids enucleation. It involves putting a telescope through the water pipe, through the natural channel, and through the telescope, a very fine laser fiber is passed, which delivers the laser energy at its tip, and it's very precise. And we use the laser energy to open up the plane between the adenoma and the capsule and enucleate the adenoma in its natural plane. It is a very safe procedure because it involves irrigating the bladder with normal saline, which is fluid at its normal osmolality to body fluids. Therefore, if this fluid is absorbed by the body, no ill effects are observed. The laser energy effectively enucleates the prostate. At the same time, we can stop the bleeding because it has a coagulative effect as well, used at different wavelengths. We can alter the energy of the laser, which will have a coagulative effect. Therefore, we can stop the bleeding as we go along. Therefore, this is a very effective enucleation involving very little bleeding, and it is safe because we are using natural fluid, normal saline. Also, because it has very little penetration, it has less effect on the nerves that go around the prostate, which is responsible for our sexual function and continence. And therefore, there is less effect on those functions, preserving sexual function and continence to a larger extent, compared to the fact that it achieves a very effective and a large cavity and a very wide deobstruction to give the patient the best chance to void freely, and therefore having the lowest reintervention rate in a long period of time, lasts for about 20 years, compared to other procedures available. It is not painful at all. The operation is usually done under general anesthetic. Therefore, the patient does not feel anything. Postoperatively, the condition is not painful. Patient usually has a catheter for about 24 hours, maybe 48 hours. The amount of bleeding through the catheter afterwards is very little and usually settles within a few hours. And usually the catheter comes out in 24 to 48 hours and the patient can go home and is mobile. Apart from very strenuous activity, no other activity is restricted. So the recovery time usually is 2 to 3 weeks, after which the patient can resume all activities. The recovery time is usually about 3 weeks, during which the patient can be normally up and about and active and no restrictions on food or drinks. They need to have a good fluid intake, and they can resume all activities, physical, after 3 weeks.